Dr. Sunanda Java. Today I would like to talk about Addisons disease. Addisons disease is the deficiency of cortisol and aldosterone hormones. This can occur as primary form or primary type or secondary type. Primary adrenal insufficiency, that is Addison's disease, occurs when adrenal glands are damaged and produce less cortisol and aldosterone hormones. Secondary adrenal insufficiency occurs when pituitary gland doesn't release enough ACTH hormone, which that is adrenocorticotrophic hormone, which activate adrenal glands to produce cortisol. So coming to Addison's disease, it mainly I am talking about primary one. Here the Addison's disease can occur as a primary form. So this can occur due to autoimmune condition or infections like tuberculosis, fungal infections, HIV, or surgical removal of adrenal glands or amyloidosis, or as part of polyendocrinopathy syndrome. Cortisol is a steroid hormone that helps the body to respond to stress like illness, injury, or surgery. It maintains blood pressure, heart functions, immune system, blood glucose level, and the cortisol is very important for life. It's essential for life. Aldosterone also is reduced in adrenal insufficiency. It's a hormone that maintains the balance of sodium and potassium in the blood. This aldosterone controls the amount of fluid removed by kidneys as urine. So this affects the blood volume and blood pressure. Clinical features of Addison's disease is something like a flu. So many times it's misdiagnosed as a flu and treated for fever or infections. So what are the clinical features of Addison's disease? They are fatigability, which is the most common thing, hyperpigmentation of skin or patches of skin, vitiligo, abdominal pain, nausea, vomiting, diarrhea, anorexia, weight loss, muscle and joint pain, dehydration, then low blood pressure, orthostatic hypotension, then low BP, low mood is affected, and there are behavioral problems also. There might be depression, poor concentration, salt craving, very important, then hypoglycemia, and also abnormal menstrual problems, loss of body hair, decreased sexual drive. So it can also lead to life-threatening condition called Addisonian crisis. Then coming to diagnosis of the Addison's disease, we have to check the levels of sodium and potassium levels. The sodium levels are decreased and the potassium levels are increased. And we have to see for cortisol and ACTH levels of in blood. Then we can do ACTH stimulation test. So giving artificial ACTH and seeing for ACTH levels can be done. This is ACTH stimulation test. In Addison's disease, ACTH levels are decreased. Then one more test apart from ACTH stimulation test is insulin-induced hypoglycemia test. So here we give fast acting insulin before and after checking the blood sugar levels. So the cortisol levels are decreased. Then we can do CT scan to see for adrenal glands and pituitary glands destruction. So we have something called as adrenal crisis. It's a similar condition like in Addison's disease. Severe form of Addison's disease features are seen in a condition called adrenal crisis. This can happen in dental clinics where the patient is on steroid supplements, and due to stress, due to procedures in dental clinic, the pituitary adrenal, cortisol levels are not enough to cope up with the stress. So the patient might have severe signs and symptoms of Addison's disease and might die on the dental chair. So it's fatal. So we have to give a injection of hydrocortisone to treat the condition. And then coming to management of Addison's disease, we can give hydrocortisone to replace the cortisol, and we can give fludrocortisone for aldosterone replacement. So, this coming again for adrenal crisis, this can happen with corticosteroid supplementation. So, when the person is on corticosteroid supplementation, the pituitary adrenal axis might be affected, and this can lead to less stress tolerance and can lead to adrenal crisis, can be treated for hydrocortisone by hydrocortisone. Thank you very much. Bye.